Welcome to Rumor versus Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths. Today, we're putting claims about tetracyclines to the test.
All right, Don, let's jump into this question here. What rank do you think doxycycline, a tetracycline, holds in the list of most prescribed antibiotics in the United States? What do you think?
I do see a lot, so easily top 10. I would put around 6 or 7.
Yeah, it's about 4th, believe it or not.
Oh.
And in this episode of Rumor versus Truth, we're going to be looking into these claims behind tetracyclines to see, frankly, if they are based on any evidence. And I'm Steve, the pharmacist.
And I'm Don, the pharmacist.
And you know us from Pharmacist Letter and Prescriber Insights. In this podcast series, we've brought to be designed to help pharmacists, prescribers, patients, even technicians too, to help navigate some of these claims, because pharmacists are trained to help clear up some of those nuances and the rumors and to identify the truths. So maybe we should start with some background, Don. What are some examples of tetracyclines that come off the top of your head?
You're quizzing me, huh, Steve? So let's see. The ones I know about: tetracycline, doxycycline,
Classic, yep.
Minocycline. Yeah,
Sweet, yep. And then we got some newer ones too, right? Like omadacycline, aravacycline. And maybe some less ones use like tigacycline and demiclocycline. So there's a lot of these guys out here. And what they really do is they kill bacteria by stopping their protein production. And they've been around for a long time. I was looking back and I found they were started in the 1940s, almost 100 years ago. So that's pretty impressive. And what kind of things do you think about, Don, what we use these for now? Because I feel like there's so many indications.
Yeah. So third quick question. Thank you, Steve. Let's
keep them coming.
I would. It's a wide variety of indications, right? So you've seen them from acne to pneumonia to anthrax. Hopefully not anthrax, but it is used for anthrax.
Oh, true. Yeah, I forgot about that one. That's a really good point.
Okay. So let's today let's see if any of these claims about tetracyclines, if there's any ring of truth to them.
That's good, Don.
All right, I'll kick us off with the first one. Okay.
Nice.
So the claim actually is doxycycline should never be used in kids under 8 years old due to teeth staining. Heard about this one.
Nice.
We've seen this historically. Routine use of tetracyclines may cause teeth discoloration in kids. But let's kind of put that in perspective. Usually the teeth stain that we're seeing in children with the tetracycline drug class, it's usually superficial and reversible, usually on the dental cleaning. And CDC actually came up with a study showing that really doxycycline has no effect on teeth discoloration. And American Academy of Pediatrics as well show that as long as it's used short course within 21 days or so, there's actually no harm to the teeth that's been shown.
So 21 days and 3 weeks? As long as it's within that window.
Yeah, within that window. And
nice.
There was a study about, they just say with dentists as well. So they actually took 2 groups. One set of group were children that were taking doxycycline for Rocky Mountain spotted fever, and a group of children who weren't taking doxycycline. And the dentists, they were blinded, so they didn't know what category the children actually fell into. And when they were cleaning their teeth, they couldn't tell the difference between the children who had teeth discoloration from doxycycline versus teeth discoloration from other places. So the dentists themselves couldn't really identify doxycycline induced, teeth discoloration.
Nice. That's pretty
actually
creative.
This is actually, yeah, I know. So it's, straight from them. But however, this is a good time to bring up, regular dental cleanings for patients, every 6 months or sooner if needed for these particular patients. So, and also what about the other ones like minocycline, tetracycline? Well, those are rarely used in kids under 8 because of the narrow indication for those. Usually it's acne.
True.
So we don't see those in children, under 8 years of age. So let's go and take back at the claim and get a verdict. So the claim is doxycycline should never be used in kids under 8 years old due to teeth staining. And the verdict is rumor with conditions. So I did mention that, there is a possibility of superficial, tooth discoloration, but if doxycycline is the drug of choice as a short course, use it.
Yeah, that's a great claim to look at, Don. That was awesome. And one you could sink your teeth into. So thank you for that. And this one always gives me heartburn. This claim that doxycycline monohydrate is better than doxycycline hyclate, two salt forms of the same drug. And this has so much history and complexity to it. I actually reached out to an infectious diseases pharmacist colleague of mine, Dr. Michael Deaney at Children's Hospital of Colorado. Awesome guy, very knowledgeable. So let's see what he has to say about this. Thank you for joining us today, Dr. Deaney.
Hey, Steve, thanks for having me.
Good to see you again. And let's just jump into this question here. What is this claim behind monohydrate versus being better than doxycycline hyclate? What's the claim there?
Yeah, the claim is mostly based on a tolerability standpoint, so not so much efficacy. It has to do with GI side effects related to the hyclate formulation. Basically, it's a hydrochloride salt and is potentially more irritating both to the stomach as well as to the throat, which could cause esophagitis.
Okay, and is there any evidence to back this up? What do we have out there that supports that?
There is evidence about it. I did some digging, and a lot of it, surprisingly, is in cats, of all things. Specifically, like Journal of Feline Medicine is where I was finding a lot of the information. Essentially, they were finding, based on anecdotal case reports, that there was esophageal ulcers in people, and they tested that in cats and found that the hydrochloride salt formulation did have a propensity to do that. It was just more corrosive to the tissue. So when they did develop the monohydrate, they did comparisons again in cats, and monohydrate had a far lower propensity for causing that.
What about in humans, though? Yes or no? Do they have evidence for that?
Unfortunately, no. And when I tell you I scoured the internet, I scoured the internet. I could not find any data that compared the stuff directly in human tissue. Unless cat tissue, not that I'm a cat expert or anything, has a higher propensity for ulcerations than humans, though, it definitely raises concern that it could potentially be in humans as well. And when I looked at an adverse event reporting database in Australia, it was definitely a lot higher for hydrochloride than monohydrate.
Interesting. And how would these two salts compare with things like absorption? Are there any benefits there?
They've been compared in studies in the 80s when monohydrate was first coming onto the market in humans, and there's no differences in terms of absorption, half-life, really any of its PK/PD properties, which is good. So from an efficacy standpoint, they should be identical. There's not a lot of studies looking at efficacy, but they should be.
Interesting. So just based on how the drug moves in the body, it's likely that they treat infections exactly the same.
Exactly.
Interesting. So the best we've got in terms of differences on cats, and some observational data in humans. Okay.
Exactly.
That was incredibly helpful, Michael. I'm going to bring this back to my colleague, Dawn, and we'll see what the verdict is.
Sounds good.
Well done. It's interesting that most of the data we have is in cats, and I'm glad my cat, my orange tabby, wasn't in the room to hear about those experiments.
Right. Well, I'm really glad we got to that too, because it can get a little salty with that topic. So
it's a good one, Don. So that said, with this claim that doxycycline monohydrate is better than doxycycline hyclate, the verdict is rumor, but with conditions. I have to ask you this, Don, too, before I move on. Let's say a community pharmacist gets a prescription for doxycycline hyclate. Can they just change it to monohydrate? What's the story there?
Oh, yeah, we get that question a lot. And I'm glad we got to this question because we hear this a lot during our live CE webinars. We're glad to answer it. So in this particular one, it just depends on the state. So if you're in an Orange Book state, and you can look that up, usually those, the changeover from the salt do require a permission from the prescriber. So kind of keep in mind of your state laws. Also, if you're in an Orange Book state, to kind of keep that in mind.
Yeah, so don't just change it willy-nilly, even though they pretty much are the same. And there is one other thing to point out too, Don. Even though these are two different salt forms, one thing you got to do for both is these patients should definitely take each pill with a tall glass of water and sit upright for 30 minutes to prevent that pill from getting stuck in the esophagus and causing all that irritation we were talking about. So a lot of good points there, regardless of the one you pick.
Okay.
And then on a related note too, to what you were talking about before about discoloration with teeth, this next claim I see is minocycline can permanently discolor skin. Let's take a look at that one real quick. When I was looking into this, I found that minocycline does have reports of causing a bluish black pigmentation of the skin, and even nails, maybe teeth, bones. I even found one case report of a woman whose breast milk turned black from minocycline. Yikes, right? And usually when it involves the skin, it's the shins or ankles or maybe the arms that you see this discoloration. It's happened enough over time that there's even like a grading scale for this type of pigmentation adverse effect. Kind of weird.
Okay. So in the words of my daughter, why? Why?
Good question.
Why does this happen? Do you have an
Why
answer?
is this
Yeah.
even happening? Well, looking at this, we're not totally sure, but there is a theory maybe it has to do with iron maybe binding to the minocycline in the body and depositing in these tissues. We're frankly just not totally sure. And what we do know is that it typically occurs in places where maybe there's scarring, inflammation, or even things like sun exposure or sunburn. And patients who've reported this sometimes are taking a lot of minocycline, like 70 to 100 grams total throughout their entire course.
Grams? Okay.
Grams. Right? That's a
Mhm.
lot of minocycline. And it can develop over months to years with continuous use, and it can take even years to go away, if at all. So when it comes to this claim that minocycline can permanently discolor skin, the verdict is true, but with conditions. Like we were talking about, it can depend on the dose and things like that. And speaking of sunburn and sun exposure, we should really be recommending all of our tetracycline patients to be using sunscreen because all these, I believe, can cause photosensitivity. And it is recommended that patients taking long-term minocycline get their skin checked yearly to look out for this. So good tidbits there.
Yeah, definitely. Thank you for that. So let's move on to our next claim. This claim is tetracyclines are toxic when they expire. Now, I remember hearing about this in Pharmacist, I believe, that there was back in the 60s, so quite a while ago, there were people taking expired oral tetracycline, and it was the byproducts of the breakdown were causing kidney issue, something called Fanconi syndrome, in these particular patients. And it was sort of attributed to the toxicity of the tetracycline, just to break it down to these, like I said, these toxic byproducts. And patients actually they were not nausea and vomiting. They actually had metabolic acidosis as well. So kind of serious condition.
Yeah, that sounds pretty bad.
Yeah. So, that from the 60s, but carried all the way through to today. So actually it's resonating, from being taught today. Well, does that still have that same issue? But you can kind of be rest assured that there have been no recent cases of toxicity with expired oral tetracycline because of just the formulation change from the 60s to today.
Nice.
And that actually kind of holds true to, the doxycycline and minocycline and the other drugs in that class. There hasn't really been any recent case of toxicity from taking expired medications. And let's just go back to the claim here that tetracyclines are toxic when they expire, and the verdict is it is a rumor, but with conditions. So while, the expired tetracyclines aren't toxic from what we've seen, there is a danger to lack of potency when it comes to expired medications. And, to give a little hint to everybody else, that will be the topic of our next podcast when we discuss expired medications.
Yeah, excited for that one, Don. That's going to be great. And then the next thing we have here is tetracyclines cannot be used during pregnancy. And this kind of goes back to what we were talking about earlier, Don, about teeth staining. There's this concern that maybe the fetus, their teeth will stain, and even potentially some bone growth suppression as well. And looking back at what I could find, this is based on, again, studies from the 60s, like you mentioned with expired meds, where premature infants who got tetracycline had decreased bone growth, but thankfully it was reversible. And there's also this thought that, or data rather, that there is some fetal teeth staining when it's taken during the second and third trimester of pregnancy. But what's interesting here, Don, is that's really the most experience we have with these issues. And now that's been extrapolated to all the tetracyclines in the entire class, maybe unfairly. We're not totally sure because tetracycline doses back in the day were way higher than we use now. And in fact, doxycycline binds to calcium less than others. And maybe it has less bone and teeth issues because of that. And going back to actual studies in pregnant patients from the 1990s, even up until last year, showed that in the first trimester, major malformations are pretty rare, if non-existent, with tetracycline and doxycycline. But we really don't have that kind of a data to look at the second and third trimester. So we're not sure in that phase. Other things to note here too is that we really don't have any diseases or infections in pregnancy where this class is even first line anyways. Really, the only one I could find was Rocky Mountain spotted fever that you mentioned before, and that's pretty darn rare. So when it comes to this claim that tetracyclines cannot be used during pregnancy, the verdict is true, but with conditions. Like we said, it does depend on the trimester, with the first trimester having the most evidence for safety. But we have to be realistic here, folks. There's a lot more antibiotic options we could use that have good track records in pregnancy and should be used rather than these. So keep that in mind.
Right. And that'll kind of take us back to our final claim. Stevie did mention calcium and doxycycline, so that kind of segues nicely into the last claim. Is tetracyclines shouldn't be taken with food or milk. Interesting. So, we've learned that tetracyclines work better in an empty stomach. How really true is that? So looking at like oral tetracycline itself and oral omadacycline, that is true. I mean, food and or milk can interfere with the absorption of those particular antibiotics. And basically how it works is, get a nerdy for a second here. Tetracycline and omadacycline molecules, they're really hungry for certain metals, and that calcium and iron, usually found in dairy products and other food, they like to bind to those. And when they bind to them, they make them insoluble and they're hard to absorb, and there's issues with that. So with this particular oral tetracycline and omadacycline, empty stomach, 1 hour before or 2 hour after meals kind of situation.
Right.
So what about the fourth popular one that you mentioned, Steve, earlier, 2002's top 4 antibiotic, right? Doxycycline, what about that one? Well, that one's hungry for calcium and iron, but a lot less than the other ones. So there is an absorption issue with, those with those cations of, iron and calcium. But it seems a lot less affected by those.
Interesting.
Officially, doxycycline, the labeling and your auxiliary labels that print out with it will say, hey, empty stomach or avoid it with food or milk. And that is true. It does like to bind to those particular metals. But if the patient says, I need to eat something because doxycycline is wrecking my stomach right now, then they can take with some food.
Yeah, I would want that.
So usually, and usually that will help. So just keep that in mind. And also Minocycline is kind of the same boat. Technically, the drug class does have issues with milk and food, but it's not really reported with that particular antibiotic as well.
Good to know.
Going back to the claim, tetracycline shouldn't be taken with food or milk. True, but with conditions. It depends on the antibiotic and the patient's comfort level when taking that particular antibiotic.
Yeah, good point.
All right, so it looks like it was a mixture of truth and kind of rumor day, Steve, with a lot of claims being factual or with conditions on that one. So real 4-ring circus going on, right?
Yes, circus indeed. And you made some really good points there. It's interesting how some of these claims do apply to certain tetracyclines, but maybe not others. And I think it really speaks to how with any med, we have to think about the individual med and not necessarily the whole class. Just like we have to think about the individual patient and their needs, right? Like you were mentioning before. And there are some really good counseling points in here, folks, all across the board, from drinking water with every dose and sitting upright for 30 minutes and making sure you take it with water versus milk and things like that. And keep in mind, folks, today we only talked about oral examples. Some of these are available IV, like IV doxycycline. And for my folks in the hospital, I do remember about you. So that can also be irritating to the veins as well. So it's a good reason to make those IV to oral switches as soon as you can to avoid that vein irritation. So good thoughts all around for all sorts of practitioners.
Yep. And thank you, Stephen. With that, we took a real bite out of this episode, and that's a wrap on this episode, actually, of Rumor versus Truth.
Right. And if you like what you heard, folks, be sure to follow, rate, and review the show wherever you get your podcasts. And of course, please check us out at trchealthcare.com.
All right. And take a look at our show notes or description. We've linked directly to some of our great resources, like the article on safety of tetracyclines in pregnancy and lactation in our March 2025 issue of the Hospital Pharmacist letter and Hospital Pharmacy Technicians letter, as well as our handy dandy chart reviewing antibiotic safety evidence in pregnancy and breastfeeding.
That is an awesome chart, super handy. And if you aren't already a subscriber, don't miss out on these resources, guys. Sign up today to stay ahead with trusted insights and tools. And we are an industry-leading, non-biased source of information and continuing education.
Great. Good one. And if you're a student, great news. Students can access a free version of the Pharmacist letter. We link that directly in the show's notes as well for free. Again, free. Check it out, please.
Also, we need your help compiling more rumors and truths to analyze. So please send us your ideas at trchealthcare.com/contact-us, or use the contact us link at the bottom of your TRC Healthcare homepage. And believe it or not, we got some new things too. You can also send us a message right in the podcast show notes as well. Just click that send us a text link and let us know what you think. Claims you want us to demystify, or even give us a compliment. We need them, right?
Yeah. Or even just say hi. We always like that as well.
True.
And and join us next time when we'll dust off those claims about expired medications.
Yep, and thanks for joining us on Rumor versus Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths. See you next time.